Welcome to Your Wellness MD podcast. This is where family physician and wellness expert Dr. Daniela Steyn and her life coach sister JB share holistic solutions for your everyday health and wellness challenges. We explore the connection between a healthy body, mind, and soul, and share tips that will enable you to thrive. Thanks for joining us today.
Good day from me, JB, your Wellness MD podcast host. I'm excited to be here with you today.
And welcome from me, Dr. Daniela Steyn. I'm a medical doctor as well as a functional medicine doctor.
Today we are talking about a topic in which both of us have a lot of experience. Me on the patient side.
And me on the doctor as well as the patient side. And that is migraines.
Migraines are an uncomfortable part of life that result in a big problem for millions of people worldwide.
And apart from being a problem, it's also responsible for billions of dollars in healthcare costs. In fact, migraines are one of the most common reasons people end up in the emergency room. As a doctor, it's important to not just say, how do we treat migraines, but to ask, what is causing these migraines?
When most people hear the term migraine, they often think of a severe headache. I used to get a lot of headaches, thank goodness, not anymore. But I also used to get severe migraines, and it is not the same thing. I know headaches are only one symptom of migraines. There are many different types of headaches, so identifying the location and nature of your pain can help determine the cause. Daniela, please help us better understand the different types of headaches before we get deeper into migraines.
So the most common types of headaches are firstly tension headaches. This starts from tension that we have in our neck. And this usually spreads from the neck, our shoulder blades. It's caused often by stress or posture, how we sit forward in front of a computer or sit forward looking at our cell phones. This tension here then spread to both sides of your scalp, causing a headache. Eye strain by watching screens, or stress, or even hunger are frequent causes of tension headaches. Then another type of headache is a sinus headache. When you are sick or you're feeling congested, these sinuses that become congested has increased pressure. And then the swelling will cause pain behind your cheeks, behind your nose, or behind your eyes. This pain is often worse first thing in the morning when you wake up, or especially when you bend forward. Another type of headache is cluster headaches. These headaches are usually excruciating, and it occurs in a cluster. So that means it could happen daily, usually maybe at the same time of the day. And it can sometimes happen for several days in a month, where you get the stabbing pain on one side of your face. It's usually a result from dilatation of the blood vessels in your brain due to the release of serotonin and histamines. And this can be caused by different things. For some people, it's caused by physical exertion. For some people, by bright lights. It can even be caused by altitude. So, there are so many different types of headaches that it's important that if you do experience headaches, to chat to your family physician or your healthcare provider. And it's, as always, not to use this podcast as a diagnosis. This is to educate and make you aware. But for your individual healthcare needs, and if you are experiencing headaches, it's very important to touch base with your primary care provider to try to find out what type of headaches are you getting. And then the bigger thing is, what is the root cause of your headaches?
Absolutely. So Daniela went through a couple of types of headaches that you can get. And as we said, a migraine is a headache that can cause severe throbbing pain or a pulsing sensation. And usually that is on the one side of the head. Daniela, I've heard that the formation of a migraine attack is difficult to be explained medically. Is that true?
Yeah. And migraine get experienced different to different people. Some of my patients can get a migraine without the headache, which is kind of a weird concept, but they might, with a migraine, have a scotoma where you can't see in the one half of your face, and you get all the other symptoms with it, and aura, all the other things that we can maybe walk you through, but without the headache part. And it's still relieved by migraine medication, because the pathophysiology in the brain is still that it involves that contraction and expansion of blood vessels. And migraine happens when there is certain areas in your brain where there's decreased blood flow, and that causes an increased blood flow to another part in your brain. And that's what causes this severe migraine. Another type of pain some patients experience is a trigeminal nerve pain. So this trigeminal nerve runs across your face to your eyes and your mouth. And this nerve helps you to feel sensations in your face. And it's also a major pathway for pain. So your levels of serotonin, that is your happy hormone, really influences a migraine. Serotonin decreases at the start of a migraine. And then this nerve releases chemicals called neurotransmitters that travels to your brain and causes pain. And very interesting, something that I've only learned very recently was that 90% of the serotonin in your body is actually made up in your gut. That is why we get so much success when we look at a patient's diet to find causes of migraines, triggers of migraines, and also how to treat their migraines, is to really look at their gut and all the bacteria in their gut and the foods that they eat.
I'm pretty passionate about this subject, Daniela. As you know, I've suffered from severe migraines for many, many years. I'm so grateful that changes in my lifestyle and stress levels led me to not getting migraines anymore, or very, very rarely. I literally had to always have a migraine wafer on me, as without it, I'd literally end up in the ER. I mean, I can't even begin to describe the pain and the nausea going with it. Well, it's not nausea, it's literally, vomiting. And as you know, you don't always have a lot of warning before you get a migraine.
Yeah, and if you look at the improvement in your quality of life now that you don't get headaches, don't get migraines, and that's why it's so important for me to have this podcast, to really help our listeners. I know there's so many of you out there who are getting headaches, who are getting migraines. And if we can run through a couple of root causes, and you can establish the root cause of why you're getting migraines and avoid that, it would make such an incredible difference to your quality of life. So the warning signs that you mentioned. An aura is a sign or a symptom that people get before a migraine attack. So sometimes you can have a migraine without an aura, and sometimes you can have a migraine with this aura or warning signs. So what the aura is, it usually happens, so it's more common in migraine, 5 times more common for people with migraine to get an aura. And the aura is that warning sign. Do you experience auras before your migraine?
I do, but it's very late in the game. So I would I would feel a headache, but just a headache. I mean, you get headaches from time to time, but then all of a sudden I'd feel my mouth, it would start getting deeper. And my mouth, I would start feeling the saliva is different. Like literally when I start feeling that, I know I'm going to start vomiting in about 20 to 40, 50 seconds. And then usually I run and I try and grab a wafer if I have one, or just get to the restroom,
And that wafer you're talking about is migraine prescription medication that you're getting from your family physician.
It is. And like I say, I'm so grateful that I can't remember the last time I had a migraine. It's been years. But at the time, it would literally be no more than 60 seconds. But the reason why you need a wafer is because you literally vomit everything in your body. So you can't keep medicine inside. That's why the wafer just dissolves in your mouth and gets absorbed. That's why I would have to take that versus normal pain pills or medication.
So let's chat about the phases of a migraine. So the episodes that it usually occur in, as doctors, we classify it into 4 different phases. The first phase is your prodromal phase. It's also called the pre-headache phase. And this stage can feature painless symptoms. And for some people, it's even days before the migraine attack. It can be symptoms such as mood swings, food cravings, constipation. For some people, it is frequent urination. It can be fluid retention, where you notice that your hands start swelling up. It can be frequent yawning, and it can also be neck stiffness. But it's important to distinguish here. With meningitis, we do get a significant amount of neck stiffness. That is an emergency. For that, you have to go to the emergency department. This neck stiffness patients experience are all often more like a tension, muscular tension that they get in their necks. So that's the first. Then second is the aura phase that we've discussed. And that aura can affect your vision or your touch or even your speech. And then the migraine attack itself. That can last 4 to 72 hours. For some people, a migraine can be once a year. For some people, this can be more common. For some people, it can be debilitating, where they can't do anything else, where they really can't do any physical activity, where they have to stay in a dark room, where they can't tolerate any smells. And then for some people can have that migraine where they have that intolerance to smells and light noise and loud noise and bright lights, but without the headache. And that's quite interesting.
And as you said, that phase can last, the migraine can last 4 to 72 hours, but that's if it's untreated.
Yes. Yes. And that's why you always take your waiver, because if you're giving a very big talk and you're on an airplane somewhere and you're going to present to thousands of people, you can't cancel because of a migraine, so it is always nice if you can go and lie in a dark room and wait for it to subside naturally and drink peppermint tea. A lot of my patients find peppermint tea very helpful. But then if you are in that situation where you're going to give a big presentation or a big talk, that is when you usually use your wafer. And then afterwards, you will have the post-dromal phase. That's the final stage when the pain has subsided. And many people feel exhausted. My patients tell me it feels as if they've run a marathon. They just feel wiped. They have no energy. And they just feel generally unwell in that post-stromal phase.
That's so interesting. I did not realize these phases exist. You've had some experience with migraines as well, Daniela. Will you share with us?
Yes. So I used to, when I was younger, get a lot of headaches, migraines. And only once I learned about establishing the root causes of headaches, I started taking notice of when I get a headache, when I get a migraine. I found out of different triggers, which we can discuss later. But very interestingly, when I worked in Alberta, there was a chronic pain clinic. And all my patients who I referred to that chronic pain clinic would be put on a elimination diet where they would not eat any wheat or gluten for 3 months. And I've seen so many of my patients who would come off opioids, who've had chronic pain for years. And after they go to that clinic, they would completely come off all their pain medication just because they stopped eating wheat and gluten. And I found that fascinating because some of my patients couldn't do it. It is hard to stop eating wheat because it is in all our foods. But for the ones that did, it made such an impact on their quality of life that I really started reading up on that. And that's where I got introduced 12 years ago to functional medicine, learning more about the root cause. And then in my own life, I started journaling. And every time I got a headache, I would write it down. And then the biggest trigger that I found was sleep deprivation. So I'm a doctor and I would deliver babies. And when I work throughout the night and I don't sleep, then I would get a headache. And that's my biggest trigger is sleep deprivation. So if I worked throughout the night, the next day I would always get a headache. And if it goes on too long, if it's too many nights a week, I would get a migraine, and that can be quite debilitating.
Oh yeah, I would love to chat more about the triggers for migraines.
Yes, so there can be so many triggers. That's why it is important to journal what you eat, what you did, the emotional stressors you had, because everything is connected, what you eat, what you do, and also how it relates to your menstrual cycle. That's a very big one. Women are 3 times more likely to suffer from migraines than men. It's because fluctuations in estrogen seem to trigger headaches in many women. So women with a history of migraines often report headaches immediately before or during their menstrual cycle, when they have a significant drop in estrogen. Other women have an increased tendency to develop migraines during pregnancy or during menopause. And then any hormonal medication, such as oral contraceptives or hormone replacement therapy, may worsen migraines. Some women actually find that when they do take hormone replacement, it even out their hormones, so they might be getting less migraines than with their natural cycle, which fluctuated more.
And then family history, I suppose, and genetics
Yes.
play a role. People with family members suffering from migraines are probably more likely, correct?
Yes.
Like our mom.
Yes.
You know, she's been getting migraines since
But the good thing is, when we were kids, we thought, oh, mom used to be getting migraines. We would be getting it as well. And it was only after I learned about functional medicine and establishing the root cause that I could relay that to my mom. And she's been migraine-free for many years now, since she quit a very demanding job since she retired, but then also since she found out about food triggers, and to avoid sugar. For her, sugar was a big thing to avoid with her migraines. The other thing is that emotional stress that we get in difficult work situation, in difficult relationships, where our brain release chemicals to set you in that fight or flight response.
I want to give an example of emotional stress that caused one of my first big migraines in this little story, but I remember it so vividly. I used to work at a university. I work at more than one university, but I used to write all my professor, the dean of the business department, speeches, and I was used to presenting. I love presenting and having these very philosophical quotes to all these professors I presented. Then I started working at a corporate company. And it wasn't even 3 months in, 2 months into the job, my boss asked me to deliver this presentation to a group of sales folks. But the sales folks in South Africa were real sales folks versus here in the States. I find them a little bit softer in terms of being more PC. But there I wrote a similar presentation. I started with a quote and I ended with a quote, like I've been doing for the preceding years. And it was totally the wrong approach for that audience. And where I usually would have ended with this quote to all these professors, I ended it and it was like an epic fail. And I was so excited about this job. I was putting so much into this job that afternoon when I got home, I got a very, very big migraine. So, and it was real. I was, the whole story. But that's where I learned the direct correlation between a traumatic emotional event and potential migraines.
Oh, that's a good one. And it's great if you can find that trigger and that cause, right? So that you know it, that you reflect on it. The other thing that most of my patients find are food sensitivities. And it's incredible how many of my patients, when I meet them, they don't have a problem with food. They just come to me to treat their headaches, to treat their migraines. And they come specifically to me as a wellness doctor to help them find the root cause. So it's people who say, I don't want to just take Tylenol and Advil and over-the-counter medication. I don't want prescription opioids for this headache. I want to find the cause. So those patients are quite dedicated in journaling and trying to find triggers. And we often find that processed foods, that would be anything that you get out of a bag, like chips or crackers, anything that doesn't come the way it comes from a farm, anything that was manufactured in a factory can cause it. Aged cheeses is a very common trigger. Artificial sweeteners such as aspartame and definitely monosodium glutamate, MSG. You usually see MSG on the packaging, are big causes for migraines. For some patients, it can be citrus fruits such as oranges or lemons, tangerines, mandarin oranges, because in that food has a high concentration of tyramine. Things like cheese, yogurt, and beans, but most common if you're a patient sitting at home and thinking, I want to eliminate something, the most common things that it can be would be dairy. So you can try to go without dairy for a month. Then the next thing you can try is to eliminate all gluten from your diet for a month and see if that works. Eggs is a very common one. Yes, I often have patients who would think they're not allergic to eggs. And as we try to find the cause, when they eliminate eggs for a month or two, they might find their headaches goes away completely. And once they reintroduce eggs, they get headaches again. Then you should stay away from eggs. So that's a big one.
And then imbalances in the gut. You spoke about gut health. That
is a very fascinating topic. And I'll just mention it quickly. We should actually have a whole podcast on that. Yes, just because it is, some patients would have a leaky gut, and then even though they maybe have a healthy diet, their body doesn't absorb enough magnesium. So they can have magnesium deficiency, and magnesium is our relaxation mineral. And if you're deficient in magnesium, you're more likely to suffer from migraines. Or that whole connection between your gut and your brain means that you need the serotonin, which I mentioned, gets made in your gut. You need in your gut healthy enzymes, which you get from eating lots of different fresh fruits and veggies, probiotics, prebiotic foods, omega-3 fats. All of these are so essential for a healthy gut. And then once you have a healthy gut, you'll really experience less headaches. That's fascinating.
Yeah, and like you mentioned, the magnesium. So just taking a magnesium supplement is a good idea in any case. And then another factor that something you taught me a couple of years ago is to not skip a meal. Because I often, when I get busy, I forget and I really don't, get angry at all. But to be consistent, to not skip a meal, even if you introduce a protein shake or have an apple and whatever else, just ensuring that you don't skip a meal.
I often find in emergency department when someone comes in with a migraine that their blood sugar might be a little bit low. So that's quite important. So even if you didn't start off with low blood sugar, when you are getting a migraine through the stress response, your body might be using more glucose. So it helps to eat something. And if you can't eat, if you're nauseous, to have a few sips of juice to just bring your blood sugar up while you're getting while you're managing your migraine. So that's a big thing. Another big thing is caffeine. So to really avoid caffeine drinks, there is significant caffeine intake will stimulate your blood vessels to cause vasoconstriction. You can have caffeine withdrawal that can cause headaches. So to be very cognizant of your caffeine use, that's the big one.
And then sensory stimuli, bright lights, sun glare, that can induce migraines as well.
And if you know that, you'll just invest in good sunglasses, and you might even reduce then the frequency of your migraines just because you're wearing sunglasses.
And the same goes for loud sounds, strong smells, including perfume, paint thinner, secondhand smoke, and other can trigger migraines in some people.
Yes. A big thing is sleep. A very big thing, and you'll be traveling back to the States today. And that component of jet lag, traveling between time zones, is a big cause. And for some patients, it is even helpful to take a little bit of melatonin at bedtime. Even if you do not have jet lag, if you've been really struggling to find the cause of headaches, for some people, it's helpful to take 1 milligram of melatonin at bedtime and see if that helps you get a better quality of sleep, more hours, and reduce your headaches or migraines.
And then physical strain, you've mentioned, can also be a cause, like an intense workout, heavy exercise, or even sex can cause a migraine. And if you suspect that physical strain is causing your migraines, you should still be active, but you might do better with a more moderate pace.
Yes, and find an exercise that works better for you. And then there's also that changes in weather and barometric pressure. Many of my patients would say, when the weather is like this or like that, they experience migraines as well.
And then medication.
Yes. So your medication could very likely be a cause of your headache. And it's important to talk to your doctor that's prescribing your medication, whether it's oral contraceptives or vasodilators such as nitroglycerin, which people take for their heart, that can activate migraines. And even if you do get migraines a lot and you're on migraine medication, you can have a rebound effect, and then a byproduct of the medication that you're using to treat your migraines can cause more migraines. So it's so important to really touch base with your physician and find, the cause of your migraines. And then there is also something called a weekend migraine. So this is quite interesting, but if you're all stressed during the week and you're go, and your body has to hold everything together, and then on weekends you can just chill out. Some patients experience that change in their routine on a weekend, or not having the same stress of the week. They kind of have to hold everything together during the week, and they can just relax and let go over weekends. They then experience migraines over the weekend. So it's not that the restfulness is causing the migraine. It's more that your body knew it had to hold everything together during the stressful episode. It's like you having the migraine after your talk, right? Because during your talk, your body knows it has to hold everything together. And then afterwards, when you just chill out, it can happen that you get a migraine.
And I used to, sometimes, this is now years ago, when I still had more stress in my life, I would, like the second or third day of a vacation, I would always get one.
When your body just starts relaxing, eh? But now that you practice mindfulness, you practice meditation, you have better work-life balance, you don't get that because your body is not as stressed out during, that's fantastic. And that's the goal of us having this podcast and sharing this with our listeners. We want to increase your quality of life. We want to help you to find that trigger and actually enable you, because you're going to find that trigger on your own. The best way to try to find that trigger is to start journaling. Every time you get a headache, write down the date. How severe is your headache? What did you eat the day before, the day of? And you can go on an elimination diet on your own. You can get rid of common food allergens like dairy and gluten, and sugar is a big one, caffeine. You can try magnesium. That's a good supplement. Mm-hmm. You can take 300 milligrams to 600 milligrams. You can take it twice a day. We've advised that when we spoke about sleep before. It's very good to take bedtime, but if you're taking it specifically for migraine, you can take 300 to 600 milligrams twice a day. And you're the one always asking me about supplements in general, right?
Yeah, we should do a whole podcast on the best supplements.
Supplements, what's magnesium. The best bang for your buck? Yes. But vitamin B2, riboflavin, is a very good one. You can take 400 milligrams a day. And that vitamin B component really helps for headaches. We can talk about leaky gut, but at a later stage, but you might think that you're getting enough nutrients through your diet. But if you do have a leaky gut, your body might not be absorbing all the nutrients in your diet. So vitamin B12 is a big one. And to balance your hormones, that's a big one. If you know that it is related to your hormonal cycle, you can balance your hormones by exercising, by eliminating caffeine and alcohol and sugar, by eating a diet rich in plant foods. I'm not promoting that you have to be a vegan or a vegetarian, but I am promoting that you should have at least 70 to 80% of your diet veggies. And that's something we should have a whole podcast about diet, because there are so many myths out there. And I get people who maybe follow a vegan diet, but they eat so many processed foods that they're not getting adequate nutrients. So whichever diet you choose and is right for you, the importance is to really push veggies, to really have 70 to 80% good veggies, trying to eat all the different colors of the rainbow. Try to eat at least 200 different veggies throughout the year, so that you're getting all the different micronutrients from all the different foods. Specifically for migraine, foods that have been shown in studies to be very helpful is broccoli, flax seeds, and tofu. Those three are very big.
And then something else that we've spoken about is sleep, ensuring that you get enough sleep and working on your sleep routine. We've spoken about that in a previous podcast, but prioritizing your sleep will also aid.
Yeah. So do you want to summarize for our listeners?
I'd love to. Migraines can be caused by a couple of factors, including sensitivity to foods like peanuts, dairy, eggs, gluten.
Yes, gluten is a very big one. And then hormonal imbalances. That's when your body has too much estrogen or not enough estrogen. And hormonal fluctuations can be worsened by stress. It can be worsened by consuming too much alcohol. And it can be worsened by sugar, flour, and starches, or not getting enough exercise or enough sleep.
And then vitamin B deficiency can cause it as well as imbalances in melatonin. Yes. And newer studies have shown that this may be related to sleep cycles once again.
Yes. So remember, all migraines are not the same. I will have on my website, it's www.wellnessmdhealth.com. I will put a whole blog on migraines where you can read through this again and to try to really help you find the cause for your headaches. Please speak to your own healthcare provider to help you find the cause and work hard at it, because it's going to improve your quality of life so much once you find your individual root cause of your headaches or migraines.
Thank you so much, Dr. Daniela. It was so fun chatting about this subject, and I hope it gave you some food for thought. Thanks for listening today. Please, if this meant something to you and you found it to be helpful, please share this podcast with a friend who can benefit from it. And please follow us on Instagram and all the social channels.
Take care.
Thank you. Have a lovely day.
Thanks for spending your time with your Wellness MD Doc Daniela and JB today. For more episodes, subscribe to our podcast. We would love to connect with you at info@wellnessmdhealth.com. And remember, you were created to thrive. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.